Hi, I'm Peter Adamo, Chief Executive Officer at Waterbury Health. Waterbury Health is composed of over 20 separate locations where we deliver care, in addition to a home health agency that operates in the entire region here surrounding Waterbury. As such a large employer and service deliverer, we have an obligation to do things proper in the community. We're at our Southbury Village site. Nearly 10,000 square feet of space here. We have primary care, we have session space for our specialists who come through. Next to us is Easter Seals. There's a large orthopedic group that also locates here, and our Access physical rehabilitation operation is just a couple of doors down. We're very proud to be in Southbury, and this is just the start at several other places that we plan to develop similar presentations. Our next location will be in Wolcott. Up there, we'll be doing something very similar to what we're doing at Southbury Village. Following that, we'll be in Watertown, and eventually we'll have a similar site in Naugatuck. Over the last 2 years, we've invested nearly $30 million into the hospital and its affiliate locations. Those sorts of investments have made it so much easier for our staff to be able to deliver top-notch care. We've made investments in our ORs, we made investments in our imaging centers, we've improved the aesthetics of the building. Each and every day there's something a little more sophisticated than the day before. We're excited about the remodeling of our family birthing center. Wonderful new appearances there, new equipment, new beds. It's going to be a nice destination to be able to bring new life into the world. I'm very proud of the new home for our GI lab. State of the art, does a wonderful job of receiving folks each and every day. We've created a new home for an outpatient wound center on our campus to be able to take care of folks who suffer from debilitating wounds. One of the other things I really enjoyed working on was the development of a brand new doctor's lounge. These days, doctors don't get a chance to run into each other, and what we wanted to do was create a space where they could spend a little extra time with each other and get to know each other. We've done some remarkable things, like reducing the amount of time it takes to be seen by a qualified medical provider in our emergency department. That's been cut by more than 50%. We're very proud of that, and it's all part of our no patient waits commitment to everything we do all day and every day throughout our network. Our patient experience scores are climbing. We are one of the best in the company, and soon enough I think we're going to be one of the best in the state of Connecticut. We have 5 guiding principles. The first of our principles is that patients do not wait. The second is that we're safe in everything we do, including the conversations we have with each other. The next 2 are really my favorite, that we have fun when we solve problems, and we have even more fun when we pursue opportunities. And the final guiding principle is that we find creative ways to thank each other each and every day. With more than 2,100 colleagues in the network, we're the second largest employer, and by being this large, we have an obligation to do what we can to make sure that the community has what it needs. Being a good corporate citizen is not only good business, but it's something that makes you feel good. It's one of the things I'm most proud of, is not just the way the finances have improved at the hospital, the quality has improved, but we now have a little discretionary income to be able to reinvest back into Waterbury and the surrounding region. There are over 100 organizations that we work with on an ongoing basis to improve the life of people who live in the Waterbury region. We're proud of those relationships. So the power of we is more than just 2,100 of us. It's more than the 20 locations where we deliver care. It's engaging in the community. It's working with folks who are like-minded, just like we are.
And that is the power of we.
The power of we!
The power of we.
That's the power of we.